Abby Alonso was 10 when she was diagnosed in 2009 with Hodgkin's lymphoma, a cancer of the immune system. With proper treatment, 90% of patients survive.
It wasn't as hard for me as I think it was on my mom and my brother and my dad.
Abby began a 7-drug regimen, but in 2010, doctors told Abby's mother, Katie, there was a nationwide shortage of one of the medicines, mechlorethamine.
I started to get a little hysterical. Why is it not available?
That year, 23 cancer drugs had shortages. Reasons include manufacturing problems and low profit margins for the drugs, which became mostly generic and therefore less expensive than brand name.
There's really nothing you can do. You know, you do what your doctor tells you to do. You take what medications your doctor tells you to take, and you pray that it works. And if one of those medications isn't available, you just take, the next best thing.
Doctors thought the next best thing for patients like Abby was a drug called cyclophosphamide. But the new study showed 88% treated with the original drug were cancer-free after 2 years, compared to only 75% of those receiving the replacement drug. Dr. Richard Gilbertson is Director of Cancer Care at St. Jude Children's Research Hospital.
This is the first study to clearly show that when we substitute one drug for what we think is just an equally good drug, that's not always going to be the case. So it's demonstrating a negative impact on patients.
Abby was one of the patients who relapsed. She then needed a bone marrow transplant, radiation, and more chemotherapy. Right now, she shows no signs of cancer.
What if I relapsed again, or what if something else happened? It's just really scary, that part.
The original drug in this study is finally available again after almost 3 years, but there are still 13 drugs used in cancer therapy and a total of about 100 on the FDA's shortage list.
John, Congress passed legislation last July giving the FDA more authority to deal with cancer drug shortages. I'm wondering what's become of that.
Jim, that new law has made a big difference. And the key provision is the requirement that drug manufacturers let the FDA know when there's an impending shortage. Since that new law was passed, there's been a doubling of those notifications. The reason why that's so important is that the FDA can increase imports from abroad. They can also tell other manufacturers in the United States to step up production. So it's made a big difference. Now, another provision in that law is that the FDA set up a task force looking at other possible solutions to the drug shortage crisis, and they're required to submit that report to Congress by this coming July.
Dr. Jon LaPook, thank you.